Hey there, I'm back again. This doesn't have to do with pretty. We're just gonna get this through. Worry about the vanity issue later. Oh, you notice it says I believe or believe. I believe you can do this. I'm just claiming this one for you. Okay. Before we start, I'd like to show you what other kind of crazy things for diversion can happen to keep from doing this studying. It's going to be a purse. Oh, who do you think it's for? Marriott. Anyhow, let's get on with it. Medicare Part A. A is admitted. B is beyond admission. So having that one down, let's see. Medicare Part A will pay for all the following services except A, minor surgery in a walk-in surgical center, plastic surgery to repair facial damage from a burn, kidney transplantation, or medical supplies and drugs that are used while the patient is in the hospital. A, admitted inpatient. B, beyond inpatient. So, is it A, minor surgery at a walk-in surgical center? Or is it B, plastic surgery to repair facial damage from a burn? I'm going to say A is admitted inpatient and B is beyond inpatient. It's A, minor surgery in a walk-in surgical center. Medicare Part A will pay for medically necessary inpatient care and supplies. I know you can tell me this one because you're pretty friggin' smart. Therefore, any type of surgery that is done in outpatient settings, such as walk-in surgical center, will not be reimbursed. If plastic surgery is medical necessary, for example, someone getting burned, of course they would be admitted to the hospital. It can be pretty major. And all the grafting and all of that has to be done depending on the level of burn, the percentage. So it would be reimbursed, the burn. Costs for organ transplantation, such as kidney transplants, are also reimbursed. Good job. A is for admitted inpatient. B is beyond inpatient. Okay. So Marriott, I haven't forgotten Bargello. It's just little something. Because I want you to put your stethoscope and your badge on it. And then I want to be able to embroidery FMP. And I know I will. Because what? I believe you got this. You got it. I know you do. So come on, let's get on with it. Okay. A charitable foundation plans to build a community youth center in a large urban area with a history of gang violence. What type of health prevention activity is being done in this area? A, primary prevention. B, secondary prevention. C, tertiary prevention. Or D, health prevention? It's primary prevention. And the rationale for this is a community youth center with good staffing can be an effective method for drawing the children out of the streets into a safer environment. I like that. It can reduce the risk of children becoming victims of gang violence. In addition, staff members can serve as role models or mentors for the older children. And that's primary prevention because it's just like right there. Okay, healthcare policy and delivery. Next one. A 13-year-old girl is brought by her mother to the health clinic because the girl is complaining of vaginal discharge and pain. The mother tells the nurse practitioner that her daughter is not sexually active. The mother is divorced, lives with her boyfriend, and works full-time. During the exam, the nurse practitioner notes that the vaginal introitus is red with tears and a torn hymen. The cervix is covered with green discharge. The nurse practitioner suspects that the child has been sexually abused by the mother's boyfriend. What's the best action for the nurse practitioner to take? A. Ask the mother questions about her boyfriend's behaviors. Yeah. B. Advise the mother to watch how her boyfriend interacts with daughter and to call within 1 week to discuss his behavior. C. Advise the mother that you suspect her daughter has been sexually abused. And D. Report the child abuse to the Department of Child Protective Services. Okay, so this mother says that the daughter is not being sexually active. We don't know the mom from Adam. We don't know what her priorities are. We know she's gone most of the time. She's got emotion to deal with. All of us do. We tell the mom she might tip it off to the boyfriend. She could put that kid in jeopardy, or we could. But we don't want to do that. And have her be spy game on the boyfriend while... I know. I'd report it. Mandated reporting. And if we don't, someone has to choose to do it. It's our responsibility. So it says report the child abuse to Department of Child Protective Services. There are several helping professions, nurses, teachers, mental health, that are required to report suspected or actual child elderly abuse to authorities. The nurse practitioner is legally required to report the case to Child Protective Services, CPS. If the child is in danger, CPS may ask for a court order to take the child away for protection until the investigation is completed. Talking about the boyfriend's behavior will not be effective and may put the child and or mother in danger if the boyfriend suspects that he's being watched. Yeah. So be the one that's going to help and protect, do safety. Oh my goodness. Coffee time. Here's the next one on the lighter side. Which of the following is a good example of how the utilitarian principle is applied? A. Helping a patient decide the type of treatment that he or she wants. B. Using limited societal financial resources on programs that will positively affect the largest number of people and have the lowest possible negative outcomes. C. Minimizing the bad outcome when offering treatment choices to a patient. D. Being more careful when using healthcare financial resources for any purpose. Utilitarian starts with a U, which means us, which is more inclusive than singular one. So, B. Using limited societal financial resources on programs that will positively affect the largest number of people and have the lowest possible negative outcomes. Generally, the utilitarian principle refers to societal programs, us, not you and me, but just a larger group than one. Expansive. So anyways, it'll affect or benefit the largest number of people in a positive manner. It is not used to refer to an individual or to one person. Utilitarian. Utilize resources for a larger amount of uses. How can we remember that? A nurse practitioner.
How's that working?
Pretty good. A nurse practitioner who is a recent graduate is asking an experienced nurse practitioner's opinion about managing a patient who has multiple health problems. What type of relationship exists between the two nurse practitioners? A. Collaborative relationship. B. Consultative relationship. C. A referral relationship. Or D. A formal. Once again, is it collaborative? Is it consultative? Is it referral? Is it formal? Well, it sounds as though they're collaborating amongst each other as professional colleagues, so I'll say collaborative. Oh, I can't believe it. I was friggin' wrong. Dang it. It's a consultative relationship. They're consulting with each other. I know you got that right. A consultative relationship involves an informal process between two or more providers who exchange information about a patient occasionally. Dagnabbit.